Ruby, can I, I missed the chat, the waiting room. Sorry, let me deblock the waiting room now so that people can actually just join automatically. Okay, so good afternoon, good evening, good morning to everyone. Thanks for joining our last IOA call for for the summer. Great, Lester, great to have you joining us. So I apologize, just it's not a camera day for me because of some issues, but thanks everybody who's on and who's joined. So today, as we shared today, is just an opportunity to give a quick update of where we've been in the last in the first half of 2022. We're halfway through 2022 already, guys, and to just kind of give a pitch on where we are for the IOA network. I think maybe I'm just gonna mute somebody. Sorry, I'm just muting people. And also to hear from everybody, you know, a little bit about as we move forward in the second half of the year, which will start in September. Just to hear a little bit about your interest and engagement, making sure that we are you know, sharing as much as is requested in terms of updates, but also making sure that everybody on the call and part of the network has an opportunity to contribute to this community and the way that we move everything forward. So just a quick reminder of when we talk about the IOA partnership, it's really about multiple agencies and it's about multidisciplinary approaches to promote and strengthen an understanding of outbreak dynamics for an improved, appropriate, and accountable response. So we really seek to have adapted context and country-specific support to partners. So that's all of the network members, people who join this call, and people who don't. But yeah, just to make sure that everybody kind of has access to that support and to really create a community of practice where IOA experiences can be shared, capitalized on across different partners to apply IOA in different outbreaks and public health emergency contexts. So just kind of an update of some of the projects. So we have the network calls, of course, that you're all on, and we have different talks on the calls. But we also have, as some of you may know, some of you may not, we have a core team. So that is made up of WHO, UNICEF, CDC, Epicent, LSHTM, Antwerp Tropical Medicine, or ITM. Have I missed one? No, I haven't. Under GOARN, under the Global Outbreak Alert Response Network. And that core team seeks to kind of move this project forward among GOARN and partners and all of the different actors who participate in this. So we have different projects ongoing to be able to move IOA forward. So quick update on those. So of course, the DRC is kind of our pilot. It's where IOA kind of was started or launched in terms of the IOA cells and the EVD response in 2018. And so what we're working on now is having a permanent IOA cell set up under the Ministry of Health. And so the concept note has been developed and it has been worked through with the Director General of the Ministry of the section of the Ministry of Health with public health emergencies. So we have these kind of 5 ways that IOA can be applied. And then it's about capacity strengthening. So identifying training such as R, identifying staff, identifying space. And so we've worked through that kind of budget and we'll be having workshops in the coming months to bring that forward. There's now a normative approach to having an IOA cell set up for all of the Ebola outbreaks. It's been applied for malnutrition, for measles, for the plague, and for cholera as well. We've also supported the Republic of Congo with the Ministry of Health and all key partners to use IOA specifically on an approach to look at more adapted vaccination strategies within COVID-19. And that support was completed in April, and they did a report with the co-development of recommendations through all of the different partners and workshops there. We started support in 2022 to Haiti. So they want to set up an IOA cell with the first intention to look at the broader health impacts of COVID and other outbreak risks. So we presented and approved this approach within the Minister of Health. And so we've got first workshop, it's July, it's no longer July, it'll probably be more like August. And there's already budget. So even yesterday we were on a call finalizing the budget, and they put into the budget actually having Minister of Health colleagues from the DRC included in missions to go to Haiti to support the setup. So it's really about facilitating also country to country exchange, which is very exciting. And that has been budgeted, and that is also being supported and funded actually through UNDP to the Minister of Health. But there will be obviously an opportunity as well, and this will really seek out the partners on this call and beyond to how do we collaborate in country on this approach. Another project that isn't country specific that we have ongoing is the SAGER for IOA. So the SAGER are the Sex and Gender Equity Research Guidelines. So these were developed in 2016, and they're really about supporting academic research to ensure that they consider sex and gender dimensions, and they encourage like different publishers to make sure that they don't publish or accept papers which do not include those dimensions. And we've seen those and seen that they're really great. Of course, these guidelines, and we know that there's also lots of guidelines already existing on minimum requirements for sex disaggregated data or gender considerations in outbreak response. However, despite many guidelines, we also see that these continue to not be applied. So we had a working group call, I think the last one was in 2021, on the development of this project. So we presented to the group. It's also been presented to the developers of SAGER and Gendro to be able to have sex and gender guidelines for integrated outbreak analytics, so really operational outbreak analytics. And so there's 4 phases to the project. The first one is a systematic literature review, and this is ongoing. We've got 2 researchers, one from CDC and one from MSF Epicent, who are working on moving this part forward, and we hope to have that published in September. And then there's a phase 2, which will be really participative research to understand how come we have all these guidelines and yet we fail to actually collect, or when we collect, we fail to analyze, or when we analyze, we fail to use. And that hopefully will start in September 2022, and really working through like Ministry of Health, operational partners, NGOs, UN agencies who are working in outbreak response to really understand what are those barriers, and eventually to develop sex and gender guidelines for integrated outbreak analytics to come out in December 2022. In terms of the network activities and communication and knowledge updates, so we have these working meetings that we'll talk about in a little bit more detail on the topics. We have the field exchange, so volume 3 will be coming out in July, so hopefully in the next week or 10 days. And these topics are of course linked to the network calls. We have now funding and a URL reserved for a website. So we will have a dedicated website to integrated outbreak analytics that will link up to the field exchange, to all of the kind of tools and documents and examples and case studies. Eventually we'll be able to search by countries. It'll be an opportunity also for the different network members to exchange amongst yourselves. We have also developed, and I will share a quick teaser with you all today, promotional and advocacy videos, as well as our training. So we continuously do trainings. For example, next week we'll do a support training for University of Amsterdam. Last week we did one for Social Sciences Humanitarian Action Platform. We'll be supporting partner offices in Chad, Nigeria, and Niger, who requested some IOA training for polio specifically. So these kind of trainings are developed on case by case and by request, depending on the theme, country, partner. So now I hope everybody can hear this. I'm going to try and play this. Please, somebody flag if you guys don't hear it. But this is just a little teaser.
I can't hear anything.
You guys hear it?
No.
Oh, shoot. How do you make it play? And okay, I'm gonna try taking out my earphones and we'll see if this works.
That is, who is affected, when it is occurring, and how quickly it is spreading.
Does that work?
Yeah, we can hear that now, yeah.
Okay.
And where it is spreading. In addition, we ask what pathogen causes the disease and what is the clinical impact. That is, what are the symptoms, and are the symptoms so severe they lead to hospitalization or death? This paints a basic picture of the outbreak, but it doesn't give us the whole picture. For example, it doesn't tell us why some people are more affected than others, or how families and communities may be reacting to the disease or response interventions. IOA, or Outbreak Analytics, is an approach to better understand outbreaks. IOA tells us why a disease occurs in a particular location or community at a particular time, and how the disease as well as response activities affect the communities. A better understanding of perceptions or behaviours of communities might help explain why they are at increased risk. Surveys, interviews, or focus group discussions are all good ways of gathering this information. Knowledge about pre-existing health risks or vulnerabilities, such as vaccination status, might also explain why we are seeing peaks in certain communities. This data is provided by health facilities or national health information systems, such as DHIS2. It is also critical to find out whether healthcare workers have the knowledge and capacity to diagnose and properly treat the outbreak disease. This information is found in healthcare programme reports or by performing surveys with healthcare workers. We should also investigate events or local context that could be related to the outbreak. For example, was there a rupture in vaccine supply or new policies implemented? This information can be found in local health programme reports, newspapers, or social media. Finally, it's crucial that we consider social and gender norms, such as who is responsible for treating the sick at home. Such norms may put certain communities or individuals, such as women or the elderly, at higher risk. Such information is obtained via healthcare programme reports, anthropological studies, qualitative interviews, focus groups, and discussion with staff and teams. Even though all this information comes from different sources, they are interconnected. They help us to see the various influences on outbreaks. IOA recognises that these factors may differ from place to place, and therefore is always performed at the local level and in partnership with local ministries of health and stakeholders. To find out more about IOA, please select one of these videos. What is integrated outbreak?
Get out of the video. Do you guys hear me again?
Yeah.
Okay, super. Sorry, so that's a little teaser. So as said, we have a couple other videos coming out, and they will come out in English and French to start. And the idea is that these kind of help give small tidbits about how IOA can be applied or how it can be used, and easier to kind of communicate on the approach to different partners. Oops, sorry. So when we think about like where we are in the working group, so for many of you, I know, for example, Julia's on this call, unless Alphonse is on the call, who have been on this call since 2 years ago exactly. So it was first set up in a way of really kind of creating a working group more focused potentially on social sciences to be integrated into outbreak analytics. And really as a working group to provide global guidance and collaboration platform of exchange. So we did develop 2 guidance briefs, one on healthcare worker surveys and one on evidence use, both available in French and in English. And in 2021, 2022, we did a shift a bit to focus much more on the integrated outbreak analytics approach and methods. We've been setting up sessions that are more 2 sessions per topic. There's a greater group size and implication. And we've also kind of shifted. So as opposed to being a working group, it's much more about network calls, creating a community of practice, knowledge exchange, and hopefully our support to countries, which is our overall aim, of course. And our outputs are directly linked to the field exchange as opposed to developing guidance. And we really seek to remain very open access, open invitation, open participation to those who want to be on the calls and contribute to them. In terms of, oh, sorry, my slide's a little bit funny there. So just a quick summary of some of the calls that we've had this year as a reminder. So we had a call on DHIS2 on integrated outbreak analytics. And so that was in February. And it was really looking at how IOA can make better use of the routine health information system, contribute to organization strengthening. So we had presentations from Blue Square, who are working in Cameroon and Niger. We had presentation from Brown University, as well, looking at, so this is somebody who we work with in the DRC as well, looking at how we can assert different quality of data. So it's how we analyze the DHIS2 here, really to be able to test whether that data is, if we're able to make inferences, whether there has been statistical significances in healthcare seeking behavior or health outcomes. We also did a case study from the DRC on the different ways that we actually use that with other data sources. So looking at different events, looking at qualitative data to explain particular trends that we see in the DHIS2 data, and how we're working with the Ministry of Health to kind of set that up more systematically. So there is at present kind of small group that wants to continue to work on this topic. To be able to improve capacity and training on national capacity to be able to use and analyze this data better. Also when it links to early warning. We had a session or two sessions, sorry, on community source data. So this was in February and March, looking at the challenges in using community source data, both qualitative and quantitative. So we had presentations from MSF, Epicent, LSHCM, some examples of community data in household surveys, thanks to CDC Atlanta. And we had from LHCM a reflection on, the challenges of being able to integrate community sourced data into models and into decision-making when it's, when it's deemed good enough to use. And session 2 kind of focused on discussing and starting a draft of the field exchange on community source data. And that came out in April 2022 with 4 case studies from the DRC, from Kenya, from South Sudan, and from LSHCM. We did 2 sessions as well on prediction. You guys hear me, right? And somebody would have said, okay, on prediction and risk mapping. So we looked at risk assessments. We looked at risk from PERC, WHO, and OCHA, looking at different pilots of the most appropriate risk assessment tools. We looked at risk prioritization with Epicent in the DRC with a case study from measles, looking at how surveillance and vaccination data can be complemented with community data and vaccine accessibility, as well as modeling and seroprevalence data to be able to identify targeted areas to respond and to prioritize response. We also looked at risk mapping from Royal Holloway, which was analyzing multiple data sets on risk factors and identifying high-risk areas for outbreaks in livestock in India. We also talked about challenges in obtaining all the different risk factors for data sets. And so this will come up in a field exchange in July 2022, so hopefully in the next week or 10 days. We had a session on early warning alert and response within IOA. So we had presentations looking at an IOA lens for early warning and response to public health emergencies, an update on upcoming early warning and alert response and emergencies with technical guidance. We had an EWARs in a box, principles and new features presentation, and EWAR post-2021 earthquake in Haiti, and this was a specific case study from PAHO. There's also an evaluation of the T-team surveillance system in Ethiopia. And then there were some discussions about like how IOA can contribute to early warning and vice versa. So looking at IOA, how IOA can contribute to the detection of signals, triage, events, characterization, and also contribute to response and investigation. And we had discussions on, what would be the IOA impact and timeliness and agility of EWAR, what mechanisms for systematic collection of contextual data and what that would look like, and what should be the IOA considerations for setting up an EWAR system. And so we hope to have EWAR in emergency, IOA contribution will be included in EWAR in emergencies guidelines. That is not a hope, that is confirmed. Mary-Emily, Ruby, correct me if I'm wrong. And there will also be an IOA field exchange dedicated to EWAR as well. So that will hopefully be coming in this fall. And we had also on events and timelines. So we looked at sessions that explored three main ways to explore the effect of events on outbreaks. So looking at kind of trends and epi curves. So events, both political, economic, environmental, and how they might impact an outbreak, as well as challenging in maintaining an events database. So in practical operational terms, in a country or in a particular location. We also looked at dashboards for decision making. So the case study from Africa CDC, PERC, North Carolina State, looking at COVID-19 dashboards and the example, for example, of school reopening, mask requirements and what those look like. difficulties in measuring impacts of events and timelines, and their implication and trajectory. We also looked at statistical analysis and modeling for measuring the impact of events, and that was a presentation from Alice, HTM, and Imperial, and specifically looking at COVID-19 and the effect on public health and social measures. And we would hope to be able to put this together into a field exchange. We don't have a particular date or timeline for this just yet. So just a kind of flag for the next 6 months of the working group, or come September, so 4 months. So again, I think the idea of having dedicated, or we think the idea of having dedicated duplicate sessions stringing together does help and give us more time to think through topics. And also having a direct link with the field exchange. We do have everything on the YouTube channel, so if you don't subscribe, please do. But you can also then follow up on missed sessions. So in upcoming, there's opportunities as well for smaller working groups on key topics. So for example, having a session on the SAGER guidelines to update the group, but also having potentially a SAGER session that is more run as a workshop or a focus group discussion. So a smaller group who might want to participate in that more actively. We want to have a session or some sessions on modeling and integrated outbreak analytics. This is a big topic, and I think an important one, but it's also a discussion on, do we do this as a workshop style? Do we, how do we set up potentially breakout rooms so that we really have a kind of active participation and product at the end, thinking about how modeling can contribute to integrated outbreak analytics, or how challenges in making models useful in operations and outbreak response, notably in LMICs or in real time, and how I can improve models, and also how, as opposed to just putting one into the other, can we use them at the same time, complementary without integrating them necessarily? Is that another way to work? Other discussion, I think that maybe isn't under modeling, but just a separate point, sorry, about dashboards, and when we're using, there's been a huge amount of dashboards created in COVID-19, and how are we using them actually in real time in decision making, notably in LMICs and outbreaks, public health emergencies, especially examples of like wins and failures. As mentioned, the SAGER update, we've also talked about having some case studies on the different lessons learned from the 7 different EBD cells, including one in Guinea, that have been set up for IOA. So and just very quickly onto the field exchange, then I guess hopefully we'll have a good chunk of time for discussion. So on the field exchange, just a quick reminder for everyone, the aim is really about creating a community of practice and exchange of case studies. Best practice, worst practice, all is welcome. It's really an opportunity for country partners to present their work. It could be Minister of Health, NGO, local researchers, and how it can relate to IOA. It doesn't have to be something that is for academic publication. The idea that it is linked to a working group or network call, but it doesn't have to be somebody who presented. So it doesn't have to be a presentation that turns into an article. Themes will surely repeat. The field exchange will come every 3 months. There we go. They'll come out every 3 months, hopefully. We do have, of course, some delays. There's not a lot of entry requirements, so case studies can be aligned with theme. But if you have a case study, we do really encourage, or if you have things, because we can create kind of a list of upcoming topics, and even if you have something that you'd like to contribute, but it may not match one theme, it can match a future. So please do get in touch. The idea is that it has an IOA lens, but IOA, of course, as we know, is used across different ways and different approaches. So it's just more about having integrated data sources and how those have been used. It can be 500 to 1,000 words. It could be in any language. Of course, translation is not that complicated. It doesn't have to be finished work. And it's really about, as much as possible, an opportunity to showcase country partners and local actors as well. So topics today have been on IOA and vaccination, community source data, and the next one, prediction and risk mapping. And upcoming, we're looking at prediction and risk. Oh, sorry, I wrote that twice. Prediction and risk mapping, early warning, SAGER, case studies, modeling in IOA, case studies of cells, timelines and events. But again, really do welcome other topics. And again, what we'd like to hear as well is ideas on like, how do we promote and use the field exchange better? So we've been speaking, for example, with London School, posting it on their web pages. It is really a tool that is more than welcome for you to put on your own web pages, your own organizations as well. But welcome any ideas for wider scale access and contribution. Do we translate it, for example? That's also an idea. So looking at all of your engagements, so what we'd like to hear from you, I'm gonna try and exit my full screen just so I can see everybody in the chat. It's really about, what are your preferences for topics by theme, by methodology? So as done to date, on different methods of IOA, or would we want to have topics of a specific country or a specific disease? Are there specific topics that we think should be more on a workshop setting? And are there key project requests? So for example, something that should actually be taken out of the network call and been more into a project team or a mini working group or whatever the appropriate term would be. Also on expanding the network, we'd like to, we would like to hear from you, what you'd like to see in terms of preferences for topics and themes, trainings, communication and workshops as well. So when we're talking about communication and workshops, not about the working group or the network calls, but much more on like, do you see that there would be another way to communicate or share amongst other workshops? So while we host IOA on these calls, there might be other calls. So for example, the Social Sciences Humanitarian Action Platform has a training that they do, and they invite IOA to come in and be part of that. Or if you have other trainings or events that are happening where you'd like to showcase something, how can we support you in doing that or engage with you in doing that? So those are also our kind of questions for discussion. So I'm going to stop there because that was 30 minutes almost of me talking nonstop. Apologies, it's a bit long. And see comments, questions, discussion. And I see participants if we've got hands. I'm going to stop sharing my screen so I can see everybody better. I don't know if there are any questions, first of all, any comments? Very quiet. I don't know if anybody from the team wanted to add or contribute anything that I may have missed.
No, that was great, Simone. Yeah, I think it would be nice to explore whether the current format works for everyone, whether there is any desire to have sessions in other languages or in other time slots. Thinking of Florian, who's is this like 11 p.m. for you in Australia? And yeah, and the format, whether we should switch it around a bit in terms of workshops, like you say, or training. So it'd be nice to hear thoughts from the group.
For me, the timing is fine. It's just 8 or 8:30. But I'd be interested to know more about like how much is it integrated to, I mean, it's under GORN, but like how much does it actually, like, how does that materialize, this collaboration between GORN and IOA at the moment? And is there anything planned, like what's the plan for the future between GORN and you?
Yeah, so we, a bit like I guess a bit like the collective service or GoData or other of the GORN projects. So we are GORN members, or we are supported or hosted through GORN in that sense. So it's still something that I think we're working out. It's still something that we are working out a bit in terms of details, but essentially we are under GORN, a mix kind of between GORN Ops and GORN Research. So we've been really supported by Pat Drury to date in terms of bringing this forward, in terms of always presenting, for example, at the GORN Ops calls. And being, getting that kind of technical guidance, getting that reach, being able to reach out to the different GORN partners for their engagement and support. We were also able, for example, in the Guinea outbreak, in 2021 for Ebola via GORN, deploy people specifically to work in the IOA cell. There's also been via GORN IOA support via the IOA core team and GORN specific support to the IOA cell that was in the 2021 Ebola outbreak in the DRC as well. So in that sense, there's support in terms of deployment, in terms of training, working with the training teams from GORN as well to learn, to link up with some of their training programs so that when we are offering IOA training, that is also offered via GORN. I don't know, Ruby or any of the other team, if you had something to add on that.
Simone, this is Maria Emily. Did you, sorry, because I might have missed some of what you said, but did you mention also that last week during the GORN ASCOM and the presentation of the implementation strategy by Gail and Lena Moses, IOA was definitely part of it. And I think there's a very clear wish for IOA to be completely integrated into a GORN's strategy for the ground, not only in terms of deployment, but also in terms of what does GORN do, how does GORN support countries. And then I just had another question for Florian. You mentioned that it's okay for you 8 p.m., but should we, want to engage with people, MOHs or academics, other academics that are in Australia or in the Western Pacific? Do you think, first of all, that there could be some interest? I know certainly there is some interest through Meru, Achille, but maybe in other places than Australia. And if there is any interest, maybe it would be worth having this working group network, however we call it, at a different time. Over.
No, I think the timing is fine. I mean so I can only speak for myself, and it's fine. I'm on the West Coast, so yeah. For others on the East Coast, it's maybe 10 or 11 now p.m. But I think, well, you never find a time that's good for everyone. So I wouldn't worry too much about the timing. In terms of interest, yeah, certainly there is interest from various partners. Also the affiliations I have. And where I'm plugged into the regional networks here, I'd be certainly interested in exploring more. But maybe, yeah, I mean, offline probably it's better. But there's certainly interest in the region to work on these topics, and also like upcoming opportunities for sure.
Brilliant, thanks. Yeah, and I think, we've had this discussion of like even how do we do with different languages on the calls as well as timeline or timing. Sharon and why can't I scroll up enough? Jenny, right? Yeah, okay. So in terms of, not to put you guys on the spot, do you have specific topics or issues that you think would be more in a workshop form, or any suggestions of what that would look like? I don't know if either one of you would like to speak to that a little bit in a little bit more detail.
Hi, Simone. I can just speak specifically, like WHO, Nina, like they organized in 2021 a rapid, it was a really, really extensive review and assessment of rapid qualitative social science research methods in disease outbreaks. It covered 5 different language groups and was like truly global in scope, especially around the COVID-19 literature. What emerged from that group was a set of, I'm going to get this wrong, somewhere between 13 and 15 criteria for evaluation of rapid social science research methodologies. My understanding is that right now, Tamara and Sonar Global the working group are moving forward with developing this into an evaluation tool, like literally in the next month or two. So, post summer, Northern Hemisphere summer, it seems like that would be that would be an interesting and helpful presentation to share with the group. I also am just sort of generally interested in, specifically with regard to sort of the training and workshops component of this, having sort of like smaller workshops, maybe even short workshops around sort of featuring specific methodologies, specific approaches, specific design and analysis like features that may bring us all sort of more on the same page, like having similar conversations with each other about what it is we're doing and how it is we're doing it, so that there's sort of greater translatability across different contexts and different outbreak scenarios. So that's it for me. Over. I'm happy to fill in additional details or facilitate connections offline.
That's great, Sharon. Thanks. And I think, yeah, actually that could be quite, I think it's also an opportunity, we have attended to date, a lot of the, everything has been kind of hosted or organized in a sense by us as the core team, but I think it would be a really great opportunity to use this network, that it's also something that any of you can also say, any of the partners, any of the actors, members on it can also say, we'd like to organize this, and we can support you in that organization, as opposed to, like we want to encourage that different things can be led by different network members. So that would be actually really, really great, Sharon. So let's follow up on that.
Yeah, absolutely.
Cool. And Jenny, I also see your comment of, we're seeing, Jenny, just reading your comment, I think this was like one of our original dreams. And to be honest, one of the things that was great, if we think back to the way back in the beginning of IOA, or the IOA cell, when it wasn't called the IOA cell in 2018, I think we had a lot of that, of like, okay, so we're here in DRC, we're in Ebola, and we need help analyzing this data quickly, or we need help reviewing a tool, or we need some quality control, and kind of reaching out, whether it be for data scientists, whether it be for social scientists, all kinds of support that was really provided in that way. And that was really, really great. And I think that is kind of the aim of this network, is to be able to really do that and reach out in different ways. Do you have a specific way of how you think that would be set up? Not to put you on the spot.
I'm going to try and unmute. I said, unfortunately, I've got a roof extension going on, so it might not be a good idea. But I was thinking sometimes possibly, I suppose, kind of having more of a brainstorming session. So the majority of the session is given up to the discussion. And there's kind of a couple of projects that we're working on at the moment where we're not kind of quite sure what the best methodology is to go about exploring it further. And so it would be a kind of, say a 5-10 minute overview at the start, kind of what we'd like to do and what we think is possible, but we're not quite sure how that would work. And then seeing if other people in the group can kind of respond to that. And, is it something simple? Is there, a simple tool that we don't know about, or a database of data that we don't know about? And then also talking about, well, how might we go about doing that? And might that, for instance, involve going for a larger bid? Because I think sometimes, particularly the data side of projects, is we don't actually know how much it would cost. So it's okay if a database is out there, but actually how long does it take for somebody to extract the data, to analyze the data, to go through it? So it's difficult for us to even start to think about how we might cost things in.
Yeah, I think that would be super, super helpful. And if we had if people are aware of what they're coming into, then we send out, invitations on, okay, these are the questions that are coming up. Please reach out, or please bring the right people to the call. We can kind of gauge that as well. That would be super. And I mean, I don't know if anybody has any strong opinions on this. How would, we've tested a couple of different ways in the past of going, okay, do we put up an Excel where people submit their questions, topics? And of course, as we have the website, hopefully by the time we start back up in September, we will have a website up and running, which will hopefully really help us all to manage these kinds of requests, topics, suggestions in that way. In the meantime, if anybody has a suggestion or a preference in how those kinds of topics are decided on, or those requests are made, or because of course, if we have a lot of them, we can create space that is, as we said, like we have the network call, which is maybe more general, and then these smaller groups that go out, and we use the network to organize those. And hopefully we'll be able to use the website to also do that, of where you can put in in a space on the website going, this is something that's upcoming, who would be interested, and we can kind of help you gauge and get that kind of support to engage on that topic. But of course, if anybody has ideas of what that, how that could be set up to be better facilitate that dialogue, that's also really welcome as a suggestion, or suggestions are really welcome. Sorry, first English words today. No comments or suggestions. Yeah, okay. So what I mean, and hopefully, and we really, I mean, in the meantime, while we wait for the website to come up, please do. I mean, the hope is that even via email that we do work out organizing these kind of smaller groups, and please do also reach out when there's a topic that interests you or that you think you might have, and even if it's not a topic that has been announced or has been talked about, this is where we can really kind of facilitate that participation or that engagement. Any other comments or suggestions or topics? Are there any? Does anybody have any strong feelings about the concept of themes versus a disease or a country? Are we all pretty happy with the upcoming topics that were listed, at least in terms of general, and then we can build from it? Be in favor of seeking out in-country social scientists and giving them an 80%, even with a translator. Thank you, Julia. Yes, absolutely. And it's something actually more and more we've had, like, it's on video right now, but getting DRC Minister of Health to do a specific presentation and then just using translator for subtitles, Julia, absolutely. And I think, Julia, also that there's a lot of French speakers, for example, I mean, French speakers, we have other countries, but there's a lot of opportunity to actually have sessions that are just in other languages. Like we can have a session that is also in Spanish, or have particular topics that are covered in Spanish or in French. But I think that is a really important component. Well noted. And Julia, if you have suggestions of specific individuals or specific examples, please, of course, let us know. Gwen, you have your hands.
I sure do, thanks. Just kind of flagging, there's a number of areas where Red Cross, Red Crescent would be super keen to engage. What we tend to have, I mean, if IFRC is involved, we tend to have both data and some analysis capacity. But what happens more often is we have national societies that have really significant data, but very limited analysis capacity. I know Rachel, who's normally on this call, is currently in Burkina Faso, and where they're working on a community-based surveillance project. And there's quite a lot of room for collaboration there. Indonesia also comes to mind, where they have a lot of data at some analysis capacity, but really there's just, it's sort of ripe for the picking in terms of finding ways to share that data more systematically with partners such as those who are on this call. So really just kind of highlighting that we have a lot. And it's just kind of hit and miss how well it's being used. And so I think if we could identify some countries and just get a sense of kind of who's doing what where, and then maybe able to find some synergies there in terms of where we might be able to have the most value add with the data we have.
That's amazing. Thanks, Gwen. And I know just on IFRC, for example, here, they had requested support on like better use of some of the data that they were collecting in a just recently I had this discussion with, I think, Anthropologica. But of course, as the network as well, that's something, as Jenny was highlighting, I think we really also have a capacity where if there's a country, if IFRC has teams that they're like, we have all this data and we're not using it well, can we get support on that? We're also here as a network to provide that support. There's no particular organization, like there's no organization or partner that cannot ask for that kind of support in terms of going, how do we use this better? How do we integrate this data better? You know, how can we facilitate that support? So also from that side of offering as a service, please do reach out, because we can also see how that can be better, those teams can be better supported as well. Cool. Any other questions, suggestions in terms of next steps and the upcoming, well, the fall and upcoming winter? quite in small groups today. Sharon, yes, of course.
Simone, I don't have any additional suggestions right now, but I just actually, if I could just take a quick second to really commend you for what you've done with this group in the past year, and how really rich and deep the presentations have been, and how many significant like sort of leaps forward I've seen happen within this group in terms of, integrated analytics. I just really want to give credit to what has been happening here. And I've been actually consuming a lot of stuff sort of offline, so I can't always make the meetings, but I just wanted to say thank you. And I hope you get a rest.
Oh, Sharon, that's so nice. I think we're all very grateful for that. Thank you. Yeah, we're very glad to hear that. We want to make sure that the space is really useful. And so that's really great to hear. Thank you. On behalf of the team, we're all really glad that it's a useful space. And Rice, I see your comment, and Lester, I see your hand.
Yeah,
Go ahead,
thank you very
Lester.
much. Yeah, thanks. I'm Lester. I'm from WHO, Community Readiness and Resilience. Our unit is actually relatively new. I think about just 1 year old. But our focus is communities, readiness and resilience. The past 3 or 4 meetings that I have attended, the lectures are really interesting. Many technical, many new methodologies and so on. But we're also keen on, we understand the importance of, integrating and looking at different sources of evidence, triangulating and things like that. So we kind of want to really see how many of these are applicable at the community level, which I know they are. But it's also the idea of, standardizing them and making them applicable in different countries, hoping that eventually ministries of health, NGOs, CSOs will be able to use them, and we can use them in programming. But anyway, this is new, and we are really on the lookout for innovative ideas in terms of collecting data and integrating, consolidating, synthesizing data from community level. Thank you.
Thanks, Lester. That's fantastic. It sounds like we have a lot of opportunity to be able to grow and work together then on this. So exactly. And Lester, can I ask in terms of it's beyond COVID, right?
Yeah, it's beyond COVID. So we're really looking way more, and also looking at it's all hazards as well. So COVID plus other communicable diseases as well as other hazards. But yeah, I mean, it depends also on what are the focus of the different agencies and groups here. Thanks.
Great. Thanks, Lester. Yeah, and it would be great to continue to reflect, and we really welcome. I mean, again, I know we have the group as well, but please never hesitate to reach out individually if we have any, if you have ideas or questions, or if there's something that you want to know more about, please get in touch. And even in the chat, I mean, as I see Jenny and Raisa being in touch on exchanging opportunities, it's also an opportunity for you to network amongst each other. So please don't hesitate. Normally you should be able to see the different people in the network, but if you can't, please don't hesitate to get in touch. Wait, I saw, oh, Marlo, yeah, of course. Marlo, I think absolutely. Actually, we have Alex from LSHCM, who in the upcoming field exchange has talked a little bit more about exactly the One Health in the prediction and risk mapping. And I think that is a really, really great opportunity. If you have specific people who you think, especially like any partners that you think would be wanting to join the call or be interested, and even to discuss and reflect of what does that actually look like, that would be more than welcome. Randomly, I mean, here we've just had in an Ebola outbreak right now, and we've had that discussion exactly of like, we all kind of sit at the same table, but is it really integrated, or is there just like the animal data kind of on the side? And what does that really look like? What is the behavior around animals? What is, there's all other kinds of factors other than just people come and like test the animals. And so really actually integrating that has been something a little bit more challenging, but up for a very interesting discussion. So yeah, actually, if you have specific people, that could be great. That could also be a really great discussion to have as a couple of thematic sessions as well. And what does that really look like, and how do we operationalize that better? So please, Marlo, please get in touch, or I'll bug you offline, and we can see about who should join. Anybody else who has suggestions on that as well, of course. Again, the calls the network is open, right? So if the one thing that we encourage is send the person directly, so that we can make sure they have the email, they're invited directly, so that they get all the emails, etc., as opposed to forwarding the invite, then they might not get the email updates and things like that. So and great to see you, Raisa. And if, of course, Raisa, I know we've discussed before as well, if there's anything we can do to support, and great to see that Jenny and you are getting in touch. That's fantastic. I am aware of time, so we might at the small group, unless there's any big questions, comments. We are stopping the calls for summer for those who have summer. I don't know how many of us actually have summer breaks, but for those of us who have summer months. But of course, if there are specific issues, especially working through the workshops and the calls and all of this, it does take some work and some prep. So if you have specific ideas, please do get in touch as early as possible, and we can help facilitate that space and get the right people involved on the calls and participating in the calls, etc. So we look forward to hearing you and taking advantage of not having the calls to potentially work on other smaller projects with you and your different partners. And wishing you all a great Friday afternoon, Friday evening, Florian. And we hope to be in touch with everybody in different ways over the coming months. And we'll see you all in September on the call.
Thanks, Simone.
Thanks.
Bye.
Thanks, Simone.
Thanks, everyone. Take
Bye.
care.
Bye.
Bye.